Hello and welcome to this video on how a rapid antigen test kit works. These tests are ubiquitous for many now. After 2 years of COVID-19, the dissemination, use and understanding of these little kits is highly varied. The same basic universal process works despite the source of your sample, that is oral, nasal and other mucosal membranes. All use the same underlying technology. The test is made up of 4 main parts: the wicking material or absorbent bed, a conjugate pad, a sample pad, and a mobile phase. All of this is put in a case where the relevant reading marks, locations for sample, and other things are located. All of this is done to make it relatively easy to handle and interpret. Of all the parts, the wicking pad, conjugate pad, and mobile phase are the most important in terms of what's in the kit. The mobile phase must be able to travel along the wicking material and bring it to the conjugate pad without interfering with the sample or reading. A sterile, inert formulation is best, and something like 0.9% saline is often used along with the appropriate reagent. The wicking pad needs to allow for the movement of small proteins but not big cells. This is important. It will filter out possible contaminants and some false positives from cells such as those that you get from your mouth or nose. These epithelial cells could produce incorrect results. Finally, the conjugate pad. This is where your readings appear. It has 2 parts: a positive mark or test mark, and a control mark. This shows every time, and the test mark shows if you have COVID in this example. While the outside of your test kit may vary, the basics inside do not. Even a stupidly complicated USB-powered LED test kit is the same inside in the end. You just pay much more for the unneeded circuitry. This is the anatomy of a test kit, and from here we move to how it functions. We need to explain the conjugate pad for this to be made clear. This is where all the important things happen. The conjugate pad has 2 lines. One is the control line, and this should always show as a positive result and demonstrates the test is working. It is made using an antibody or similar that binds to something in the mobile phase and allows a marker in it to be active and visible. When this shows up, you know the mobile phase has reached the testing area, and importantly, that it is able to react as intended. The second line or test line is made to pick up COVID and should only show when you are or have very recently been infected by it. It is made up of 2 things. One is an antigen to COVID-19. The COVID-19 virus particles bind here. By itself, you wouldn't see very much if there was only COVID, as it is tiny and at the best of times not easily seen when it begins to aggregate. The mobile phase has a second antibody or something similar that is either a reagent or attached to a reagent that will react and become visible. For some, this is a UV light reactive reagent. This is also called a detector or indicator. Only when you get the stacking of the initial antibody in the test area, the COVID-19 antigen sites, and the detector or indicator do you see the line appear. All 3 are needed. Either after enough of the COVID samples or antibodies bind to this region, you begin to see a test light, and in this sample here, you shine a UV light on it and it shows you a result or not. With a result on this line, you have COVID, and without it, you are healthy, or at least as healthy as you can be, not having COVID. These test kits are not only relevant to COVID, they have uses well beyond it and have been used for decades before COVID. The most common examples we're familiar with are for HIV testing. A small sample of blood or plasma is added to the test kit, and the same sort of reaction occurs. You see lines forming if they are positive. no lines, or only one line, it's a negative reaction. The advantages of test kits are many. They are small, cheap, quick, easy to run, easily made, easily shipped to anywhere in the world, stable for long periods of time, and can be made for many diseases. Because of this, they're often sent as aid to other countries that are less economically developed. The disadvantages can be somewhat more circumstantial. The COVID tests in particular rely very much on the timing of when you are doing the rapid antigen test. If you do them too early or too late, you may not get a reaction or a very strong reaction. This is generally a consequence of the change in concentration of viral particles, and the duration for which you are shedding enough of these can be what leads to that. Cross-reactivity is another issue. Some viruses will have not necessarily the same, but similar enough parts of them that the site could be considered an antigen in relation to the antibody used. Some patients simply won't develop the necessary immune response, or at least not in the right time frame for the test to work. The test that is used can also have very different specificity or sensitivity, let's say. So some tests are a much lower quality than others. Because of this and the variability in what proteins or antigens it's targeting, different test kits can have very different margins of error and hitboxes, so to speak. The different design for kits, along with the quality materials and chemicals, also has an effect. Generally speaking, cheaper kits tend to be less good. There's also storage and administration of the kit. Now they are, for the most part, idiot-proof, but there is nothing that has been designed yet that an idiot can't somehow break. Keep that in mind. These test kits are extremely useful, but they do lack the specificity of PCR testing in the case of COVID-19. That doesn't mean they don't have a place. If you have a positive result, it may be useful to then have PCR testing, because it will tell you for sure if you have it, and you can even begin to figure out which particular variant you do have. For those regions with little funding or a low skill level, and needing to disseminate the tests over a large area to many people, antigen test kits are a great idea. In fact, this is one reason why many governments, even in developed nations, are looking to use them on a large scale. They're easily sent out, or purchased, distributed, or otherwise made available. They're accurate enough for purposes, and they also provide a relatively cheap but effective measure. You don't need a great deal of skill, and they are accurate enough that you can get a good idea as to whether or not you need to take other steps. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.